Hi, everyone. I'm Dr. Natasha Iyer from Live Younger, and this is our Director of Medical Education, Dr. Shabnam Das Kar. Today, we're talking about men and mental health, especially because recently we've been discussing how men tends to have to be so stoic. They have to get things done. They're at quite a disadvantage, I would say, when it comes to discussing their mental health, acknowledging that they have mental health problems, and then seeking the help that they need. Right? I think it's when
Yeah.
they're seriously, overtly depressed, they go to the doctor and they get medication. It's also interesting to me that more men are on antidepressants now. Like when I work in the emergency department, I see it. So it seems that there's a category of man that goes for help and they come out with an antidepressant. But again, when I talk to them, it's their life is severely affected. You and I know that there's a whole spectrum of people before that, men, even as young as their 20s, starting to have mental health symptoms, and they don't realize that these are symptoms that need to be addressed. So, what are some of the things that our patients who are men and women who have men in their lives should be paying attention to?
So that's very important because sometimes I think even people who are experiencing those symptoms don't realize that these are not something they just have to bear with. So, of course,
Great
poor,
point.
low mood, low interest in doing something that was exciting to them before.
And they
Uh,
write it off as tired,
Tired, yeah,
but they're
tiredness,
mentally
fatigue,
fatigued. Yeah.
mentally fatigued. They don't want to do anything. They don't want to socialize. They don't want to meet anyone. Then there are some other things which are often not recognized as mental health challenges. One
Mm.
is increased alcohol use, more smoking, substance use, not sleeping well. More importantly, not sleeping well, either it's a person who thinks that I will sleep when I die, or it's like they have such a busy schedule, they don't realize they don't assign enough time to sleep. Now, poor sleep can be a symptom of mental health challenge as well as a causative factor. So, poor sleep can cause mental health challenges. Then, another important one, which sometimes we ignore, is being a workaholic. So, being a workaholic can be a very often it's ignored because it's like, oh, that's supposed to be a good thing. He works very hard for his family and he's, taking care of them
Mm.
well. And workaholism, by the way, it's for women as well. But these are some of the things that sometimes men don't realize and people around them also don't realize. It's like they spend more time by themselves, they are more into their devices, they don't like talking to other people, they
So
eat
that
by themselves.
withdrawal and the isolation and
Yeah,
the decreased participation in their usual lives.
yeah.
And what's interesting is that, like we have men who have trauma
Hmm.
in their past, in their childhood,
Yeah.
and there's a lot of men now on social media making it okay to talk about trauma in men. And I
Yeah.
love that because we know that childhood trauma and even adulthood trauma
Yeah.
can affect your mental health in with many different pathways to how it affects it. But the few things that I wanted to talk about today for mental health specifically, just because you and I are all about, as functional medicine doctors, finding the root cause.
Hmm.
And so when someone approaches us who are sort of mild to moderate on the spectrum. Obviously, when people are severely impacted, we do rely on the traditional medical paradigm and medications. I just saw a patient yesterday. Her anxiety, which I knew that she had some anxiety, but I didn't know it had become overwhelming. And so she went to a family doctor who gave her an antidepressant. And when she came in, she said, it's a game changer for me. My anxiety is so much better. I'm not overthinking. So we're not saying there's no place for medication, but we're saying that there are other things that can be going on in the body or wrong in the body that we would want to fix first before we go the antidepressant route, because it doesn't come without side effects, right? And so there's the flatness, the inability to feel a wide range of emotions when you're on an antidepressant, the sexual dysfunction that comes with it. And a lot of people just don't want those side effects, weight gain. And so when we look at mental health in our patients, I usually go with hormones first. And of course, before hormones, we always look at the gut and what's going on in the gut, because the gut and the brain are connected through the
Yeah.
second brain. And so gut inflammation and brain inflammation. So um, we'll end with the gut, but let's just talk about hormones, because this is men and mental health, and men have hormones too.
Yeah.
So when we talk about testosterone and its role in mood, because most people just think that testosterone is all about below the belt functions, and you and I know that there's a lot of above the belt functions. So, what do you think men should know about testosterone and the brain?
Number one is testosterone levels worldwide are falling dramatically, even
Yes.
in much younger patients. And we are seeing it almost every day because,
I'm seeing it in 20 some year
yeah.
olds now, like men in their late 20s having levels that should be at not that we think a 60-year-old should have low levels,
Mhm.
but traditionally hormone levels drop as you age, and there's a sort of range. And so we expect when you're 60 for it to be lower on the scale. And yet now I'm seeing 20-year-old, not 20, but 28,
Yeah.
29-year-olds with low testosterone
Yeah,
levels.
I see that too in my patients in India. So, and we routinely test for testosterone in every male patient and women as well. So, one is the lower testosterone levels worldwide. And we are not going into the causes. There are many food, poor food quality, environmental toxins, these are big ones. And of course, our sedentariness is another one. So, testosterone levels, number one, are falling. So, it's important for men to know where their levels are at, and that is sometimes that interpretation, it's like within the normal range versus being the optimal range.
Optimal, yeah.
Functional medicine doctors, we don't look as, because the normal range for testosterone is huge.
It's quite wide, yeah.
Yeah.
It's 175 to 700,
Yeah,
so the
it's
midpoint
like
is,
really wide. So
yeah.
that is one important thing. And the next is, of course, there are a whole bunch of, symptoms as well. And Natasha, you brought up something very important because sometimes functional medicine doctors are accused of being anti, medication. No, we are not. But what we are not, we don't completely agree is giving everyone a pill for an ail. It's like
That's
someone
right.
who's
So
mild and
testosterone levels dropping
dropping.
cause symptoms in the brain and the mood.
Yes.
And you said something about testosterone being made in the brain when we were chatting
Yeah.
earlier. So I was like, people are going to say, really? What?
Yeah.
Testosterone's made in the brain. And you said something so beautiful. You said nature doesn't do anything that's redundant. So why is testosterone made in the brain, do you think?
So obviously testosterone has functions in the brain, and Natasha, you describe it so well. I'll let you describe that, what testosterone does in the brain.
Well, like and we use the male screening questionnaire, the Q-ADAM, right? And so we know that there's a lot of mood and emotional symptoms. So it's one of the things is men don't notice these things because they're too
Oh.
busy being busy and being stoic, right? And so they don't notice that they're a bit more irritable, that they're maybe having some anxiety. But I talk to them about focus and clarity. And
Mhm.
my big thing is mental agility.
Mhm.
Because every time we say testosterone, people think, oh, sex drive and erectile
Yeah.
function. And I go, but you need testosterone. Because if I say testosterone, they go, oh, no, I'm perfectly
I'm
fine in that
perfectly fine.
area. I have no issues there.
Yeah.
And I go, oh, yeah, so you're having 7 morning erections a week. And then they look at me like, no. Okay, so then we know you got a problem. But forget below the belt. Let's talk about your brain. So it's that ability to regulate your mood. So we find that men with lower testosterone are a bit more irritable. They can also find themselves more sad, emotional. So some of it's related to the increase in estrogen versus testosterone, because, with obesity and belly fat, we have an estrogen dominant society. And then you said environmental toxins, which are endocrine disruptors, they block hormone function or they affect hormone function. And so it becomes this whole big thing. But back to testosterone and mood, we have a lot of women saying to us, my husband needs to be here. It's like he's in the menopause. And I go, yep, there is such a thing as menopause. And there's lots of emotional symptoms that we wanted to bring up. And so low motivation, kind of low mood, which some of them don't notice, but it's more like a social isolation or withdrawal, getting more on their devices, spending more time in their man cave, not doing the things, and then not being able to feel pleasure or joy.
Hmm.
You know, those are some of the things that I would want to open the conversation around and have men go to their doctors and say, I'm having these things happen. And I think women need to say to the men in their lives, you're not quite yourself. You know, let's get you
Hmm.
checked out. So, yes, testosterone is very important for mood. And before we put patients on antidepressants or recommend any psychiatric referral or whatever, you know, we want to make sure that all of these important things are looked after. Very interesting that recently I was hearing about how important estrogen is for brain function in men.
Hmm.
And, you know, you always say everybody has hormones and it's not just a male hormone or a female hormone. And I say the same thing too. So testosterone becomes estrogen and
Hmm.
then it's eliminated through the body. But there's always a balance between testosterone and estrogen. What's happening in society today is because of all the xenoestrogens and the increased belly fat, which
Hmm.
is a low testosterone symptom, and not necessary. Like in today's world, we're not going to say testosterone's the first cause of why you have belly fat. I mean, it's so obvious that it's the diet and the lifestyle and all these things. But one of the things that happens in especially our older male population, as their testosterone levels drop, it's called beer belly syndrome, right? And they gain abdominal fat, and abdominal fat makes more estrogen,
Hmm.
which, you know, is just something that happens, and we talk more about it elsewhere. But when I first started testosterone replacement therapy in men 18 years ago, I would put everyone on something called Chrysin, which
Hmm.
is a blocker of the conversion of testosterone to estrogen. And
Hmm.
at the time, well, back then the knowledge was so different, right? Like now we know so much more, but I would block estrogen in every man because I thought, oh, estrogen is going to give you man boobs. Estrogen is not great for men. Who wants more estrogen in a man anyway? So I would, you know, quite strictly block estrogen in male patients. And then the data started to come out that estrogen is important for bone health in both men and women, and that there was an optimal range for estrogen in men. So too much is bad, and none is bad as well, and very little is also bad, right? And so again, as you talk about balance and optimal, and so, you know, we started with bone health, and then I stopped blocking estrogen as strictly.
Hmm.
And now we're hearing data and evidence about estrogen being important for brain health. Now, we don't have the specifics, but I would imagine it's exactly the same as women,
Hmm.
where we need estrogen for our brains. And so, what does estrogen do in the brain?
Estrogen is again important for a whole bunch of neurological conditions like nerve and nerve growth and all those things. And definitely, mood is not just high levels of one hormone and too little of the other. Again, like you said, it's a balance in the brain as well. So those
Mm-hmm.
are very important.
And
And
and we make estrogen in our brain, and you
oh
just
yeah,
said men make testosterone in their brain, and so nature doesn't do anything for nothing. There's
mhm,
a purpose for it, and so we
yeah,
know that we need all of it. So I think the main point we wanted to make is that specifically testosterone levels impact mood, but as we approach things in our practice, we never write testosterone to someone as soon as they walk in the door,
no,
and we never just give it without measuring the metabolites and looking at what happens to it in the body, not just for brain health but for body health. And then it, you know, impacts prostate health and cancer risk and all of those things. So as much as I wanted to bring up that testosterone is so important for mood and mental health, I want to say that it's not the first thing we do
no.
with patients. So what is like when we approach patients, what do you think is the first most important thing a person having these symptoms needs to look at?
So basically, we do a review of their entire lifestyle, and there that is where gut health and food have a huge impact. So we talk about the gut-brain axis. As many of you know, the gut impacts the brain, and the brain also talks to the gut. So this is a
Hmm.
bi-directional conversation going on. And for a long time, we didn't know what the gut was actually doing, but now we know that there are these gut microbes which have an impact on our brain function. And without going into a lot of details, one thing I want to highlight is the biggest impact on the gut microbiome and the gut brain axis is number one, food, and number two is, of course, prescription medications as well. And there are a whole lot of other things, but food has the biggest impact. So if you don't have a healthy gut, it is kind of understood that your mood will definitely not be the best.
Food affects your mood. I say that
Yeah.
to everyone. There's mood food, there's good food mood, and there's bad food mood, and everybody knows this, but they may not notice it, right? Or
Yeah.
they might not acknowledge it. Like even a glass of wine can
Yeah.
affect your anxiety. You think it's
Oh, yeah.
treating anxiety, but it's not actually. It's actually increasing your anxiety
Yeah.
after. I think, what for me is really important when I work with patients is um, absolutely we put everybody on a new food style. I call it food
Yeah.
style because it's not just food, it's the whole lifestyle around it. But food is truly critical. And what I love is that even mainstream media is now talking about ultra processed food and its effect on mental health.
Hmm.
So it's easy to Google, but the data is so clear. Stay away from processed food. It affects not just your waistline and your obesity and your all over health and all the risks we know about, but it directly affects your mental health. And simply removing ultra processed food and food-like substances, as you call them, you say it's not real food, it's a food-like substance. I love that when you say that. That simple step can change your mental health and your mood. And then when you're talking about the gut brain axis, yes, gut inflammation leads to brain inflammation. And when your brain is inflamed, it doesn't work the same way.
No.
And, there's a whole process we do with patients to always heal the gut and remove the offending foods to see what happens to the person as a whole, right? And then you mentioned microbes. So a couple of things, I was so astounded. What was it, 10, 12, I don't know how many years ago when we found out that serotonin is made in the gut. And if serotonin,
Yeah.
your mood state, so your antidepressants are all affecting serotonin levels in the brain. We want to increase serotonin levels in the brain, and yet we're not looking at the source of serotonin. So imagine giving
So
someone an
one thing,
SSRI.
Natasha, the serotonin in the gut mostly impacts metabolism. It's not directly affecting the brain in that sense because it can't cross the blood-brain barrier. But that is very important because the gut bacteria help us make them. So obviously we have to eat food that helps the gut bacteria. And Natasha, I'm just digressing a little bit. I know most people know what ultra-processed food are, but what would be
Actually,
some of
no, I had a patient yesterday who looked at me and said, I don't know that I know exactly what processed foods are. And I thought, really? But she was so unclear because of all the marketing, right? And
Yeah.
that's another very important thing. Marketing makes it so difficult for our patients to actually know what is what.
Yeah.
And then she said to me, "Oh, I guess it would be if it comes from a factory, then it's not, then it's processed." And I said, "Exactly. If it went through a factory, it is processed. If it's not, and how nature made it, then that's what you should eat." And she goes, "That would be so hard." And yes, it is. It is
It
very hard
is.
because even if you think about it, a slice of bread is processed food. A
Cereals,
cookie.
Natasha. So many people start that. And I've told my patients, I said, you're starting your day with candy. And some of them are like really taken aback because they thought this, bowl of oats was the best possible thing
Healthy
on earth.
cereal. Yeah,
Yes.
but it's all been processed, right? And so, again, we're spending way much longer on this food thing and the gut thing. But, even your microbiome affects your GABA levels, and GABA is your brain calming chemical. And so we know that we have a connection between the gut and the brain. And so through that separate nervous system, there's this transmission of neurochemicals from the gut to the brain. So when we think about it, what we want to do is we absolutely need to be certain that we look after the gut first before we run out and do anything else. So gut inflammation leads to brain inflammation because they're connected. What we do in the gut affects the brain, and so we have to do them both before we do anything else. And then one other thing is that sleep, it affects how you can balance your brain chemicals if you're not sleeping enough. So I just threw that in there, but that wasn't exactly part of the plan. But I just
No,
wanted to
it's very
mention that
important,
sleep
Natasha. You
and
brought
sleep
up something very
deprivation
important. Yeah.
and lacking sleep as a priority is going to be one of the big issues for brain health in all people, let alone men. But I think the last thing I want to wrap up with is men and trauma.
Mm-hmm.
And that is something I think as much as more men might be talking about mental health or symptoms, and as like more men are approaching this conversation, maybe because their wives or women in their lives make them because they're not themselves or whatever. But the one thing that we have never given men permission in society is to be weak by showing emotion.
Mm-hmm.
And emotions are so affected by multiple things, but trauma is an experience that's individualized. And what might be traumatic to me might not be traumatic to you. But recently, very, very recently, they found a gene for PTSD on the mitochondria. What that means is that 27% of the population, men or women, predominantly women, but yes, men, can have an event trigger trauma. And now we know with all this work on the vagus nerve that it kind of gets stuck in the body and it changes how you react to stress, it affects your mental health, how you balance your brain chemistry. And I feel like the time is now where we have to allow men to say, you know what, I had a traumatic childhood. I was emotionally abandoned. I was beaten and it affected me. It doesn't mean that you had to be molested only.
Mm.
There are so many other things that fall in the domain of trauma, but it affects your mental health later. And that brings me to the final thing that I wanted to wrap up, which is cortisol. It's a hormone, and we do hormones. And the whole purpose of our talk was to talk about brain health and hormones. But I don't think enough people pay attention to cortisol. As soon as I say cortisol to patients, they go, "Oh, I thought that was a bad thing." And I go, why? And it's because everybody associates cortisol with high cortisol and stress affects you, and then high cortisol and belly fat. So everybody assumes that cortisol is a negative thing. But
We would
Dr.
die.
Carr, just tell us why cortisol is important.
So, number one, cortisol, if we didn't have cortisol, we would die. So, it's not that it's just high cortisol is the only thing, because cortisol secretion is different things at different times of the day. In the morning, it rises. But the problem comes when, because of many different reasons. Stress is one of the big ones, when cortisol levels are out of balance. And we can test that using a saliva testing. And blood test is not going
Why
to
is
tell us.
cortisol important?
So cortisol is important for us to manage our stress and, anti-inflammation, and to go for that, that acute stress response. Cortisol is one of the most important hormones at that point. So we do need cortisol. We cannot live without cortisol, but
Exactly.
we don't need either excessive levels or, more importantly, wildly fluctuating levels
That's
which
right.
are out of
But
balance.
also too low, right? And
Too
so
low.
that's the point that cortisol actually affects how our brain works. When cortisol is too high and we're too stressed, it actually shrinks the brain. It
Hmm.
affects the
Yeah.
memory center. It affects these things. So, we're talking about mental health, but we're forgetting about cortisol and backing up from there. It's stress and then all the stresses of your entire lifetime.
Hmm.
But what I say to patients is this: your cortisol has to change according to what your body needs at different times. And
Yeah.
it actually goes, at very different levels throughout the day, as you said. But what happens is when you have too high stress, it affects your brain, yes. And then if your stress remains constant, so this role of trauma or,
Mhm.
two mortgages, extra jobs, whatever's going on in
Yeah.
the world today, we have kids, we have aging parents, we have like whatever, and we have like lots and lots of stress. We're making lots and lots of cortisol, which is actually hurting the brain. And so managing our stress and our cortisol levels is really important for brain health. And I like to look at that before I give someone an antidepressant. Like, what is the role of cortisol in your mental health and your brain function if they're coming to me with mood symptoms? But there's something as important that when we have prolonged cortisol, which people say, yes, it's bad for me. I thought high cortisol was bad for me. Yes. And high cortisol for a prolonged period of time leads you into a state of depletion, which is what we teach at the workshops. Why is that so important? But as we run out of the ingredients to make more cortisol, we actually make less and less and less, and then we end up in the state of low cortisol. And so at this point, what I say to patients is you are burning out your brain chemistry
Mhm.
while you're burning out your body chemistry. And we should never forget that your body, like everyone, not everyone, a lot of people have heard of adrenal fatigue. And then I go, yes, it's hypothalamo pituitary adrenal axis dysregulation. Say that, and the reason we the name changed from adrenal fatigue to HPA axis dysregulation is because we forget about the role of the brain in this whole
Mhm.
stress syndrome.
Yeah.
But when we end up with low cortisol, we can't make a good mood because
Mhm.
cortisol affects your brain, whether it's too high or too
What to
low.
do? Yeah.
We need it to be properly regulated. And that's why we do saliva testing, right? We want to see where cortisol is throughout the day. And are there too high and too low points that might be affecting not just your body health and your energy and you're tired and you're adrenally fatigued, but we have to translate that right back to the brain. And so this HPA axis dysregulation is
Mhm.
so important to brain health and mood. And I think that's something that needs to be looked at when we talk about mental health and how to look from a functional medicine perspective, because we're looking for root cause. So when you say diet, are you eating enough protein?
Protein. Yeah.
And if you eat enough protein, you're eating enough building blocks to make brain chemistry. But can you digest it? Can you absorb it? Like there's so many other things to look at. But the key places that we focus on is, yes, do you have the prerequisites to make brain chemistry? And then it takes us down all these other little pathways, which is why our approach is so not simple. You can't come in and just get a
Get a
prescription
pill.
for an antidepressant.
Yeah.
And at the same time, even though we specialize in hormones, you can't just walk in and get a
Yeah.
prescription for testosterone, as much as it is that important for your brain and your mental health. So do you think we missed anything else, Dr.
So
Carr?
I just want to summarize a few things. Number one, as you said, people cannot just walk in and get a prescription for testosterone. Testosterone replacement is not for everybody, particularly younger people. So that is very important to know because it causes infertility in younger men. And other things besides testosterone that can raise testosterone level, you mentioned protein, building muscle mass, not sitting as much as we do nowadays, adequate sleep, and also a whole bunch of nutrients like zinc and iron. And we usually talk about a whole bunch of nutrients. It's not just only take zinc and your
I
testosterone
want
level
to I
will
want
go
to
up.
interrupt you here. I'm working with a 56-year-old man, and when he came in with mood symptoms,
Okay.
and his testosterone levels were in the like barely 300.
Okay.
And I did not write him testosterone once the levels came back. We
Hmm.
did our process, and you won't believe this. At his follow-up, he exceeded 400,
Wow. And this
right?
is
And
just
we
by,
did not write testosterone. So I thank you for bringing this point up that your first step, even when you're supposed to have low levels,
yeah.
um, it might not be that you go right out and run for testosterone, even if it's low. You might want to do all these other things, like looking at your HPA axis dysregulation and looking at your gut and looking at your liver health and your liver function. And we repleted so many nutrients for him. So we looked at giving him the building blocks, the vitamins and nutrients and minerals that you mentioned. We looked at sleep and sleep quality. We looked at, the 28-day reset that we do on everyone, really pulled out all the xenoestrogens and brought about more balance between his estrogen and testosterone as well. And so his symptoms improved, his levels improved, and we did not have to do testosterone replacement therapy
Oh,
immediately. Will I do it in the future? Absolutely,
yeah.
based on the ADAM questionnaire and his symptoms and his function. But that's the point. We don't treat numbers only either. Sorry, so that was your number one. So your number two
Number
summary?
two, number two was about, childhood adversity or adversity at any point. The message we want to give across is there is hope. It doesn't mean that if you've had a very traumatic, childhood, you're like doomed for life. No, there is a lot of help available, and it is okay to ask for help. This is something very important. And I studied medicine in India, and we were never taught about trauma or childhood adversity and how it
I
impacts
studied
people's
in South
health.
Africa, and then I used to teach medical students here in Canada. And we were told, yes, you got to look at the biopsychosocial aspect of the patient and take into account their stress and that. But what? I didn't get a roadmap that if your patient
Yeah,
has all these things, then you need to do this and this and this and this and that. It
yeah.
was like, okay, well, then you just send them to a psychologist or give them an antidepressant. But that's not all there is. And like you said, today
Um,
we have so much more information. We have heart math and we have hypnotherapy and we have, like we have so
EMDR,
many, sorry, say EMDR.
EMDR.
And all of these things are so much more useful to patients to heal their trauma, because then you're getting to the root cause.
Mhm.
When you settle that response and the nervous system calms down, your brain can come out of the constant fight, flight response. And maybe you don't have a depression or a mood disorder. Maybe you just needed to calm your nervous system and heal all of that stuff. But I will say to you, a lot of us, myself included, don't make the time. I always say I don't have the time to do all that work, Dr. Carr. Like, who has time to go look at all of this? So, sometimes the pill might seem like an easier option than to actually do the work. But because people come to us for root cause,
Mhm.
I'm very, very happy that we brought this part of the discussion up, because it is so critical. So thank you for that part. Do you have a third one before we wrap up?
Not offhand. There are other hormones as well. Thyroid is another big one, but that's for another.
Thyroid hormone. Well, no, actually, let's just go quickly. That thyroid hormone affects brain function.
Yes.
And so checking thyroid is routine for what we do and before we treat someone. And then insulin and insulin resistance, which
Yeah.
brings us to blood sugar levels. Dysglycemia affects the brain and the mood. And some people can identify that they eat
Yeah.
something and their mood changes, but the average person is eating so badly all the time that they don't understand that food and blood sugar levels and balancing blood sugar can affect the brain. Thank you for that part, because it is something so obvious that we do every day,
Yeah.
and I didn't think to mention it, and yet those are hormones too.
Oh, yeah. And, thyroid, particularly when it comes to older people, men and women, sometimes it's ignored. They are like, oh, you have dementia, or they get a diagnosis of Alzheimer's, and their TSH is like 20. You know, Sometimes people don't realize they have to check for thyroid and vitamin deficiencies and all that before
Yes.
diagnosing someone with
And
dementia.
especially like, sorry, and again, now I'm taking up more time, but people
Oh.
who drink a lot of alcohol
Mhm.
get low in magnesium. So they're using alcohol to treat the anxiety and the
Yeah.
depression, and they overuse it. And then their sleeping is worse, so it
Yeah.
affects the mood. And then the alcohol disrupts the brain and affects the brain also. But
Yeah.
then at the same time, alcohol is depleting magnesium magnesium, which is so important for calming your nervous system down and helping you make brain chemistry. Alcohol's depleting your B vitamins that are important for your brain health and your brain function. And so, it's like there's so many other things. Good God, you opened a can of worms. We'll have to do
I
a
know.
part
We better
two
shut it
on this
down, Natasha.
now. So now there's a part two that has to come out. But for today, thank you. This was such an interesting discussion. I hope it's really helpful to our patients at large, and I look forward to hearing feedback on it. As always, you're welcome to work with us, Dr. Carr and I. We are at liveyounger.ca. We have programs, we have workshops, we do online webinars, we focus a lot on education, as you can tell. So please find us at liveyounger.ca if you have any questions, if you want to join us at the next workshop or webinar, or you want to become a patient and work through our process, which you can see is very comprehensive and thorough.
Thank you, Natasha. That was a nice conversation. I hope people get something out of it. Thank you very much. Bye now.
Bye.